is small incisional cataract surgery 6, and for that and one anesthesiologist is preferred, and minimum they are doing ideally up to 50 surgery, maximum 50, and also 6 along with PCIOL. Avoid doing both eyes simultaneously. Most effective emergency contraceptive is copper T. Then ferroptosis is associated with lipid peroxidation. Pyroptosis means fever. Caspase 1, interleukin 1 and caspase 11. Necroptosis TNF receptor RIPK1 and RIPK3. So which method is not used for unfavorable cervix? Unfavorable cervix means Bishop score less than 6. Not preferred is artificial rupture of membrane. Kasai's procedure is done for type 4B, that is extrahepatic choledochal cyst. 4A is extra and intra. 5 is only intra. Missing of pills in first week, then if it is only 2 pills, take that 2 pills. 3 pills, then 3 or more, then you have to in first week take that plus barrier contraceptive. If it is in second week, again same thing. If it is third week, then also barrier contraceptive, take the pill barrier contraceptive, but non-hormonal pills do not take. That time also you start taking the next pack. Now if it is the last week means it is actually non-hormonal pills. If you miss, no problem, now you can start new pack. So you understood first 2 weeks what you have to do, take that pill barrier contraception. Next 2 weeks you avoid that non-hormonal pills and start the new pack at that time after continuing this. Next, anterior asynclitism is the presenting part is anterior parietal bone, posterior parietal bone, posterior asynclitism. If it is normal asynclitism, sagittal suture. Then CTEV, there will be cavus, adduction, varus and equinus. So up to 1 year you have to wear Dennis Brown splint, then child will be walking, so shoes, CTV shoes, and night time Dennis Brown splint. But if there is doing this properly or not corrected, then not done properly, then foot will become rocker bottom foot and all. So the order is cave, that is cavus, adduction, varus, equinus. So adduction, in order to correct that, this to avoid that or to correct that, the medial border of the CTV shoes will be straight, and varus. So varus correction is outer border is raised and heel is not there, that is equinus correction of CTV shoes. But if there is any interruption, then the order is pedo var. Just children are always var in our home, so pedo var. P for posteromedial soft tissue release, E for Evans procedure, Dwyer's osteotomy, wedge resection, arthrodesis. So that is 1, 2, 3, 3, 4, 5, then 6, 7, 8, 8 to 10, 8, 9, 10 and more than 10. Tacrolimus tremors side effect, tremors, insomnia, tramadol also tremors, right? Aberrant obturator arteries. Actually obturator should arise from internal iliac. Here it is arising from external iliac artery. and it is injured when you are doing Lockwood operation for femoral hernia. Lockwood means lacunar ligament, lacunar ligament reflecting. At that time it can injure if there is an aberrant obturator artery. DVT Wells criteria is eat chips. Here you want to know how much score for each criteria. So E is edema, that is clinical signs of DVT. A for that is alternate diagnosis is excluded. Then T for tachycardia, it's not tachypnea, tachycardia, chips. C for, so here chips, C for cancer, and H for hemoptysis, I for immobilization, prior DVT, and S for history of surgery. So here most of them it can be 1, 1.5 and 3 for initial E and A. 1 and others are mostly 1.5 and 1 is for, so maximum point for 2, minimum point is 1 we are giving, and that is for 2, that is chips, C cancer, and H hemoptysis. Now definitive treatment for decompression sickness is hyperbaric oxygen therapy. What is Winder's formula? So whenever you are given metabolic acidosis, to know whether there is compensation, you do this Winder's formula, that is bicarbonate into 1.5 plus 8 plus or minus 2. Glulysin is rapid like Lispro and Aspart. So these three pulses are look like similar, but first one, it in the systolic itself 2 peaks, so it is bisference. Then it is bigeminy, that is a premature ventricle contraction. Then alternately high volume, low volume is alternance. Then you have crista terminalis, anterior to that is the, so you know in the atrium you have crista terminalis, and anterior to that is the rough portion, and posterior portion is the right horn of sinus venosus, that is forming the smooth portion of right atrium. Left horn is forming the coronary sinus. Then next is patella fracture. If it is undisplaced, then cylinder cast is enough, which you are putting up to above the malleolus and the leg in extension position. Whereas if it is a transverse fracture, then you will put tension band wiring. Syncope and type 2 Mobitz 2 heart block, then it is Stoke-Adams syndrome. 100% MAC, that is maximum MAC is, that is it, the lowest potency, that is N2O. Von Willebrand disease type 1, 2, 3. 2 is qualitative, 3 means autosomal recessive and absence, means quantitative, and it is complete absence. Sleeve gastrectomy has more risk for GERD. In the sleeve gastrectomy, if you are making a root limb and Y limb, then that is pancreatic, alimentary limb and biliary limb, then it will become duodenal switch operation. Now if you are putting one limb in the up, here stomach having only one limb connected, that is biliary, this is duodenal switch, but biliary pancreatic diversion, there will be two connection with the stomach. Can opener capsulotomy is in phaco emulsification. Can opener, there is no CCC, continuous curvilinear capsulorhexis, in phaco can opener. You can remember when you open your phone, you get a lot of fake messages and also can opener. Then next, PCV by RBC count MCV by RBC count. PCV by RBC count is MCV. MCV by RBC count is Menzer index. LCIL, then if high risk you do HPV, but if it is HCIL, next is colposcopy biopsy. If this HPV is also positive, next step is this colposcopy biopsy. Posterior relations of lesser sac is, so remember epiploic foramen posterior relation, that is IVC and T8 vertebra. Here it's not that. This is relation of lesser sac is the stomach bed, like a stomach, transverse colon, then splenic flexure, pancreas, spleen, celiac trunk, splenic artery. So this is the posterior relation. Keep updated. Bye.